Hi, my name is Isha Saldhi, and my preceptorship was at Kaiser Permanente. So when you guys hear the word cancer, what's the first thing that you think about? Yes. Chemotherapy. Anyone else? Yeah. Struggle. So the first thing I think about is tumors. So generally, for all kinds of cancers are pretty similar, but they all have a different kind of special things to them. So throat cancer has polyps. So polyps are these fleshy nodules that are generally benign. Occasionally, however, these polyps can become cancerous. In order to treat and remove these polyps, the physician has to do an epigastro-duodenoscopy. This procedure is basically doing an endoscopy, which is sticking a scope into the throat and going through down the esophagus to the stomach and to the small intestine. Basically, if the polyp is found in any of this region, it's removed and is biopsied. And so, my first day in family medicine, a patient came in and she was in distress. She thought that she had throat cancer. Generally, when a physician is looking to see if a patient has throat cancer or not, they're looking at a few common symptoms. They're looking at redness, they're looking at swelling, inflammation, they're looking at white spots on tonsils, sore throat, vocal changes. So this patient, when she came in, the doctor assessed her and checked her throat for any of these symptoms. She didn't have any redness, she didn't have any swelling, she didn't have any vocal changes. The one symptom she did have, she had throat irritation. So this throat irritation, it lasted for 10 days. She came in on her 10th day. So at this point, the physician does not know that there's any serious problem that needs to be treated. They think that this throat irritation can be caused for many common reasons, such as a cold, the flu, or allergies. So they don't think that there's any reason to be worrying about cancer at this point. But this patient tells us that she had a previous history of having an endoscopy 5 years ago. In this endoscopy, she claims that they found polyps in her throat. So we look into her medical record to see if any polyps are found, and we find something really weird. There was no indication of any polyps in her medical records, and the doctor said that nothing was found, and the endoscopy went perfectly. So we go back to the patient and we ask her, "Are you sure that there was any polyps found? The doctor's notes say that nothing was there." And the patient says, "Yes, the doctor told me for sure that there was polyps in there." And then we're like, maybe there's a miscommunication going on because there was no polyps found. But she's insistent. She thinks that there was polyps found and the doctor told her. So then we go back, and when the patient is this insistent, we think that maybe we should do something. But a procedure like an esophagus gastro-duodenoscopy could be dangerous and cause more complications. So we don't want to do anything that could cause more problems for the patient in the long term. So we tell the patient this, that there's no reason to get an endoscopy done at this point, because it just might cause more problems for her. But she's insistent, she's not convinced yet. "I need an endoscopy." But causing an endoscopy could just cause more problems. "But I need an endoscopy, I know it's time." But getting an endoscopy would just cause more problems and complications and hurt you more. "But I need an endoscopy, I know that there's something going on." So we go back and we talk to the patient, wondering what we can do to help her. And at this point, we don't want to do anything that's wrong for her. So the doctor tells her that he'll send her to another specialist in order to see if she should get an endoscopy or not. So you may think that this patient is being overly worried and that she has no reason to fear because she has basically no symptoms of any significance, and her previous endoscopy came back negative even though she seems to think that there was something there. So when you look deeper into the patient's records, you find that she had a reason that she was so worried. She has family risks of getting cancer because many people in her family had gotten it before her. She was worried that she was going to be the next one. So looking at this, 5 years ago when she came in and the doctor probably told her that there's no polyps found, she probably just heard polyps and freaked out, thinking that there was something wrong and she needed to get something done and that she had polyps and she could get them again. So if the doctor had just looked at the basic picture and just seen the symptoms that were immediately in front of him, he never would have found out about the patient history. He never would have found a connection in order to determine what was actually going on with the patient. He needed to look at the bigger picture. He needed to find out what was going on with the patient and what she was thinking mentally before giving her any sort of treatment. In this case, the best treatment was to help her and was to send her to a specialist in order to make her understand what the problem was and how it would needed to be addressed. If he just dismissed this patient and didn't help her and didn't connect with her and try to get her to open up about what she was thinking and why she was worried about getting cancer, then he never would have found the problem and he would not have done what was most beneficial for the patient. So in life, generally, when we have problems, we just find the solution. We jump into it and we try to do what we need to do to fix it. But we're often forgetting one of the most important steps, actually learning about what the problem is. We need to figure out what the root of the problem is, what's causing it, before we can even attempt to fix the problem. So in this rotation, it taught me that we need to look at something more than what's right in front of us, and we need to take into account everything that is there in order to truly assess the problem and deal with it, and we can do what's beneficial for everyone involved then. Thank you.